everyone. Good evening. We have a really great group.
Thank you.
Good evening. I see some familiar names. It's good to see everyone on this lovely Thursday. Thanks for joining our speaker series. We have a really great speaker and expert in the world of lymphedema. It's a really interesting topic. I know that I am looking forward to learning a thing or two myself. Perfect. We'll give everyone a couple more minutes to join our Zoom before we get going. Just a couple housekeeping tips. If you want to keep yourself on mute throughout this presentation, especially if there's some background noise going on, just so we don't disrupt Lympha. And we'll have question and answers towards the end. So we've got a great group coming in. Happy Thursday. We're really excited for our monthly speaker series. This has been great. Lymphedema has been a topic that comes up quite a bit. So I think we'll learn a lot. Get your pen and paper handy with all of your questions. We've got a great group. Okay.
Okay, my name is Evelyn Brewington. I don't see my picture up. What do I do to get it up?
I can help you.
Okay.
So, Evelyn, so good to see you.
Hi.
Let's see if I can help. There we go. Okay. I just asked to start your video. So
Okay.
with that being said, there you are. Hi, Evelyn.
Yeah. Hi, how are you?
Good, how are you?
Good.
Okay. So again, just a couple housekeeping items for the evening. We are recording our speaker series this evening. So all of our speaker series episodes are available in our Her library. So if you missed episodes from the past, and if you have to hop off a little early this evening, or if you want to go back and re-listen or share with another friend or family member, you're welcome to do that. But they're all available in our Her library. So you can go to uniteforher.org/Her library. I'll also post the link in the chat. Hi, Sheila. Yeah, it's so good to see you.
Hello.
How are you? Hi, Marie.
Yes, I can't get my picture up.
Okay, I can help you.
Okay.
Know that because we are videoing, if you want to keep your video off, if you don't want to be seen, you absolutely are welcome to do that. Again, I'm just asking everyone keep their sound on mute once we get going and once Neepa gets started. And that way we're not interrupting her at all. So
there I am.
We've got a really great group. There you are.
There I am.
I'm so glad everyone is here. We have a really great speaker. So I'll keep letting some people in, but I think we'll get started just so that we stay timely with our evening. So let me spotlight myself for us. So I want to welcome everyone to our August series of our speaker series. As I said, we have a fantastic topic tonight. I know just in speaking with our community, this question around lymphedema comes up a lot. Why does it happen? What can you do about it? What are some factors that affect the cause or the extent of a person's lymphedema? So we have a fabulous expert in the area of lymphedema therapy, but also in rehabilitation in general. So Neepa will reiterate that once she gets through her presentation, she will be able to speak to a lot of different topics and answer a lot of different questions about rehabilitation in general. So with that being said, we will do question and answers at the end. She will take us through a presentation just to teach us about lymphedema. What is it? Why does it happen? And go through some factors. So if you have some questions, she may answer them through her presentation, but then towards the end, we will open it up. You're welcome to use the chat to ask your questions. You're also welcome to unmute yourself if you'd like to ask, but I know we'll be covering a lot of information this evening. So again, keep your pens and paper handy. All right, so let's find our guest for the evening, Neepa. I will bring her on. There she is. Hello, Neepa. How are you?
Hello, Erin, and hello, ladies. How's
Hi.
everybody this evening?
Good.
Very good. My
Very
name is
good.
Neepa. I'm an occupational therapist and a certified lymphedema therapist, and I've been in the field, I feel, forever. All right, go ahead, Erin.
Okay, so to start, I would love to give a beautiful introduction of our esteemed host that we have. So Neepa is the CEO, if you are unfamiliar, of Bucks Cancer Rehab, and she is here again to talk about, do some education, answer all of our questions about lymphedema. So a little bit about Neepa. She graduated from Bombay University with a bachelor's degree in occupational therapy in 1994. She migrated to the United States in 1996 and worked in a variety of settings from pediatrics to geriatrics in New Jersey. She passed her boards in 1997 and got her Lymphedema Therapist certification from Close Norton Institute in 2003. So she definitely has the experience and the time behind her knowledge. Neepa developed the breast cancer rehab program in Princeton Hospital in 2007. And in 2019, Neepa received her certification in oncology rehab through the PORI Institute in Colorado. She has devoted her career to make cancer rehabilitation available to every person going through their journey. And she aims for making a functional difference in every patient's life. And I know just in speaking with her throughout this week and leading up to our event tonight, you can really feel and hear that from her. So I know that we are in for a really special evening, learning a lot. Have your pens and paper handy, and let's get going. So Neepa, I will turn it over to you to
Thank you
take
so
us
much,
away.
Erin. I mean, when somebody else talks about you, it sounds like, oh my God, that's a lot, but I feel very humbled. So ladies, I am going to share my screen. There's a small presentation that I'm going to do. If you have to leave, you can ask me questions right there and then. But if you can hold off on some of the questions till the very end, this will go much faster. So I'm going to start sharing my screen here. All right, can everybody see the lymphedema?
Yes.
All right, very good. All right, so today we are going to talk not just about lymphedema, but an integrative treatment approach to lymphedema. So, the number one question is, what is lymphedema? So lymphedema is an abnormal accumulation of lymphatic fluid in the interstitial spaces due to removal of lymph nodes, blockage, or destruction of lymphatics. Now, these two things that I've highlighted are the most important things that happen in any cancer patient. So what are the leading causes of lymphedema? We have a primary cause, which is sometimes people can be born with less lymph nodes, or there is a hereditary incidence where lymphedema can occur, like your aunt or your parents or somebody else in your family actually has a gene for lymphedema, then chances are high you would develop it like later in life. Like, we see that a lot with school teachers and nurses who do a lot of standing jobs. The other cause of lymphedema is a secondary cause, which is the most prevalent in the United States. That is, one of them is something called as filariasis. Filariasis is an infectious disease that is caused by a mosquito carrying the filarial virus. And what happens in that case scenario is that the mosquito actually bites a person and lays eggs in the lymphatic vessels, and a person ends up with lymphedema. Now, this particular disorder is typically not seen in the United States. We do see it more in the Central Americas, more in the Southern Asian countries. What we do see in the United States is the neoplastic obstruction of lymph flow, which is the metastatic obstruction of lymph flow. There is also the radiation damage to the lymphatics. When a person does get radiation, it's like collateral damage. The lymphatics are damaged. Post-operative interference with the lymphatic flow. So we have to remember, lymphatic system is like a secondary plumbing system in our body. We have our venous system, the arterial system, and then there is the lymphatic system. A focus on this lymphatic system did not happen until the late 80s in this country, unfortunately. I mean, I do see my patients who have had surgeries in the 60s and the 70s with large arms, which nowadays, fortunately, I do not get to see because there is so much knowledge available on the lymphedema and on the lymphatic flow and lymph in general. So in the United States, the leading cause of secondary lymphedema is surgical or radiation therapy for cancer if it is accompanied by lymph node dissection. And some of you ladies may be aware of the term lymph node dissection because I'm pretty positive some of you have undergone lymph node dissection. All right, so when a therapist treats you for lymphedema, a therapist like myself or an MD, okay, when do you want to see a therapist? Should you wait? Should you not wait? The first rule of thumb is you find any kind of discomfort in your limb, in your leg, in your arm, in your chest, don't wait. Call the doctor, get a script for lymphedema treatment. So the first stage of lymphedema, we call it stage 0, is completely reversible. Like, when fluid starts accumulating, I'm able to actually move that lymph. I'm able to actually create, with manual lymphatic drainage, create new lymphatic vessels. And that is where is the most crucial time when a person should see a lymphedema therapist. Stage 1 is another reversible stage where we do see, like when I do girth measurements, and some of you might have had that, where a therapist takes a tape measure or an instrument like the Solo or the bioimpedance device, and you measure for lymphedema, which is existent in the interstitium. Some hospitals do offer that kind of a service where they measure with a bioimpedance device. In my office, I find girth measurements to be the most reliable type of measuring for lymphedema. Stage 2 is an irreversible lymphedema. That's when you actually see all the signs and symptoms of lymphedema. Like, you would have your family or like your friend who looks at you and says, oh my God, the arm is swollen. Oh my God, the leg looks so swollen. That is an irreversible stage. So that is when lymph fluid in the interstitium along with secondary skin changes. That's when you find like hardened skin and there's still fluid that cannot be moved. Stage 3, typically in this day and age, I have actually not seen, which is a good sign because that is a completely reversible form of lymphedema where some amount of surgical intervention is required. And frankly, there are very few surgeons who nowadays will actually operate on that type of lymphedema also. All right, moving on. Risk of lymphedema development, resetting our thinking. The lymphatic system has the potential for optimal healing and regaining its strength and endurance, enabling you to achieve your maximum goals in all areas of activities of daily living. So what this means is no matter whether you have stage 1, stage 2, stage 3 lymphedema, no matter the stage, we are able to obtain our maximum ADL function back. So how do we do it? So listen to your body. You got to be proactive. Kathleen, did you just doze off there? Are you awake, Kathleen? She's the first person I'm seeing on my screen. All right, so when you listen to your body, be proactive, talk to your doctor, start skilled intervention early. Therapy can be started as early as 2 to 3 weeks post-surgery or post-radiation. don't wait for the doctor to tell you oh, you can wait 6 weeks, you can wait 10 weeks. It may be too late by then, because the lymphatics need a chance to regenerate, and second to third week is when the lymphatics can actually regenerate. Get educated about lymphedema. Most hospitals now, where you will have your surgery or where you've had your surgery, have possibly given you something called as a pre-rehab education flyer, where they talk about what to expect after your surgery. They talk about exercises after your surgery. They talk about what signs and symptoms to look for lymphedema. So watch for also the warning signals: heaviness in the limb, general achiness, fatigue of the limb, general tingling. So the tingling happens when patients come and tell me, I have tingling and I have pain in my arm. What has happened there is that lymphedema has accumulated and is compressing now on the nerves. Stressors and triggers: any kind of new strenuous activity, repetitious activity, changes in atmospheric pressure, which happens when flying. And this is one of the things that therapists always talk about. When you fly and you've had some trauma to your lymph nodes, do wear a compression garment, or most therapists will talk about that. Any injury, insect bites, and new weight gain. These are new stressors for developing lymphedema. So you want to watch out for them. So what to do next? What needs to be in our toolbox when it pertains to lymphedema? So if you have had a diagnosis of lymphedema, the first thing a therapist will do towards the end of your therapy is fit you for a compression garment. And it is best to have a therapist fit you for a compression garment, because most therapists like myself are actually certified compression garment fitters as well. Always when you travel, have Neosporin in your toolbox, have an antihistamine. Why? Because you don't want that bug bite on your lymphatic arm or your lymphatic limb to become into a skin infection. Because from what we know, when fluid sits in one part of the body, we want to remember that this fluid is not the fluid that your body loves. It is the fluid that your body doesn't want. And it is just sitting there, and imagine a nick or a cut or a bug bite on there. It is a portal for infection to enter in. And that is why we want to have alcohol pads, Neosporin in our toolbox. We want to carry all this in our purse, and everybody nowadays sells travel size of all of these things that I have mentioned here. And I think, alcohol pads, we all have plenty of since the start of COVID. So please carry them with you and wipe off the bug bite, the nick or the cut that you have developed. I have seen in my entire career many patients who come in and with a red arm, and what happened was, oh, I just nicked my arm. I was outside and a rose bush, I just nicked me. And lo behold, I had to send them to the ER because they developed a skin infection, which eventually became septicemia, and they had to receive some kind of an antibiotic drip. So we want to avoid all these things. All right, moving on. Understanding the key factors. How can a therapist help? So after cancer treatment, cancer surgery, radiation, what is a therapist looking at? How is a therapist going to help you? Posture is number one. A lot of my breast cancer patients who come in to see me, a lot of them have a lot of kyphotic posture because we want to protect, and we go into this kind of a posture. We want to keep everything under control because that's the only way we can control something. And that is no good for your breathing, and that causes neck pain, that will cause shoulder pain. Then people end up with restrictions in their shoulder range of motion. Limb heaviness and girth. This is what a therapist will do. They will measure to see how much more volume you have in that particular limb after your surgery. A therapist will teach you how to do exercises appropriately so you do not develop any loss of range of motion. So tissue fibrosis after radiation. Currently, I have actually a few patients who I am just seeing for the fibrosis that has happened, the damage that has happened after radiation. So when it comes to radiation, I feel like I need to elaborate this a little bit more because a lot of folks go through radiation. So in simple words, and some doctors would have explained this as well, radiation is for killing what we cannot see. Because when it comes to solid cancers like breast cancers, ovarian cancers, tumors, the solid cancers, there are a lot of unknowns still that exist. And you go through your chemotherapy, which kills a lot of the cancer cells, but the radiation is what will cause the tissue fibrosis, because radiation typically just genetically modifies the structure of that organ, that skin. So what I see now is like hardened tissue, which is in front of me that I need to work on. And a lot of therapists, including myself, are also certified in myofascial release. So these are techniques that, when done correctly, can actually help regain tissue tensile strength. Tensile strength meaning tissue mobility, which is another important factor why we need to see a therapist. So more on how a therapist can help. So a therapist looks at typically a lymphedema or a cancer therapist is doing a full body approach. We are not just looking at why, just a little restriction in the shoulder. You could have had radiation in the abdominal area and end up with shoulder contractures. And I've seen that also. And the reason being, our fascia is so connected everywhere that restrictions in that fascia is sort of a pull in the abdominal area. When radiation happens in the abdominal area, there's a pull, and people end up with the opposite side shoulder restriction. So we are looking for what restrictions is the patient facing. So an initial evaluation is always done before you see a therapist for treatment. We always do an initial evaluation to come up with some goals and what you actually want to achieve as far as your activities of daily living are concerned. All right, what else? You guys might have heard of something called as the axillary web syndrome. And is it treatable? Yes. And what is axillary web syndrome? So oftentimes after radiation, after a sentinel node biopsy, after axillary node dissection, people do develop, and this is an extremely common thing that I see actually, in their armpit. The patients would come and tell me, I just cannot feel what is going on there because I feel there is something pulling in my arm and it feels like threads. And that's exactly what it is. So what happens in this case scenario is when lymph nodes are removed, there is scar tissue that builds up on the vessels because all lymph nodes are connected to vessels, lymphatic vessels, and scar tissue starts building on these vessels. And it is just a normal thing that the body does for healing. And what patients see is like these rubber band kind of string-like things that run from the entire arm sometimes into the breast chest tissue. And when a therapist works on that, we are actually releasing this kind of scar tissue. Sometimes people have relief within a day. So therefore, it is very important to go see a therapist right away. Now, the Commission on Cancer in the United States actually has, and most of the hospitals are also certified under this commission. They always will include a referral to rehab services on-site or outside. So basically, once you undergo cancer treatment, it is imperative. It is actually the doctor's duty to send you for rehabilitation, which some doctors know, some doctors do not know. But I just wanted to put that blurb in there that it is actually put out. It is actually a service that the Commission on Cancer, if the hospital is certified, then they have to give a referral, no matter whether you have a problem going on or you don't have a problem going on. Once you're done with some kind of cancer surgery or cancer chemotherapy, radiation, you do get a referral from your surgeon or your oncologist. All right, this is only the beginning, ladies. Most of us lead far more meaningful lives than we know. Often finding meaning is not about doing things differently or doing things in a new way. It is about seeing familiar things in a new way. So what is this like, I read this in like, I think it was kitchen table logics or something. I have the book from this surgeon. What this means is like, you live with lymphedema, and for most of the time, I do not want to say lymphedema is a lifelong condition, because there's new things happening in the lymphedema world. There are new medications that are being studied in Finland and Europe, and we will be getting them sooner or later. I think everybody is now focused on COVID, and nobody's talking about like medications for lymphedema, but they are in the making, and sooner or later we will have them. But you live with lymphedema. What can you do with this lymphedema? Like, do you want to stop what you were doing, or do you want to do something big? Is like, what I feel my patients need to know. All right. So in the end, I'm just going to put a little blurb about me. I graduated from GS Medical College, which is, I hate to say it, but I'm very proud to be a graduate of this college, because it is the Harvard of India. And it was rather difficult getting in there. And how did I come to the United States is because in the 90s, there was a lot of deficiency of therapists in this country. So hospitals used to actually come recruit us directly from our colleges, just like they do recruiting nowadays. At that time, I had the whole world right in front of me, great salaries, and that's how I came to the United States, got board certified, and have never stopped since. All right, ladies. So I think this is the end of it. I just went through it really fast, but I'm sure you ladies have a lot of questions, and I am going to now stop the screen sharing, and I'm going to be ready to take questions.
Perfect. Thank you very much. That was, I'll hop on here with you. So that was amazing. Very thorough. And I think we can all say that we all appreciate you going through and sort of laying the foundational work. So if anyone wants to start putting questions in the chat, Neepa and I will both monitor the chat. I'll start us off. I know from a nutrition perspective, when I chat with our community, I see them coming in fast and furious. I love it. I'm often asked from a nutrition perspective, what can I do? Is there anything from food that I should be doing, foods I should be avoiding? So from your perspective, Neepa, what do you tell your patients?
So when it comes to a diet, it is very important to have a diet high in something called as bioflavonoids. It's not something that doctors would talk about very much, but bioflavonoids just increase like fluid movement in our bodies, be it the arterial movement, be it the venous movement, be it the lymphatic movement. Lymphedema by nature is by far a very sluggish kind of a fluid that sticks in your arteries, sticks in your lymphatic vessels. So in order for that to move, like we need to ingest something that will help it move faster. And the best way of doing that is eating your citrus fruit, eating your melons. These are the best things. And they are also like, they wouldn't increase the estrogen in your body, which is also one of the things that often comes up. So stick to your citrus fruit. They have the best bioflavonoids and exercises.
Excellent. Excellent. Good to know. Okay, starting to go through some of our questions. Kate said her lymphedema has gotten so bad in her left arm. She had 21 nodes removed. They're considering surgery. Have you helped any patients, post or pre-surgical patients?
Yes. So Kate, is this lymphedema more after treatment? Like, have you had lymphedema treatment with a therapist?
Yes, I have. So I had, after the surgical procedure where I had the double mastectomy and the nodes removed, I did not have any lymphedema present, but I immediately began physical therapy 3 times a week. I wore the reduction sleeve at night, and then I wore just a regular compression sleeve and the glove during the day. I did that all through radiation. It seemed like after radiation, where I had 30 treatments, that's when the lymphedema really kicked into gear. And then it's just been getting, I wouldn't say worse, maybe progressively slightly worse, but just maintaining its status, which is pretty bad. I have the neuropathy every day. It's pretty tingly. It's very uncomfortable for most of the day. I take gabapentin for that. I would prefer not to. But they've mentioned a surgical procedure. One of the doctors at MD Anderson, it's a lymphatic bypass where they make the incisions on my arm, 4 to 12, depending. And then it's like a resection of the blood vessels.
Yep.
So that's
actually what happens in that type of surgery. So there are 2 types of surgeries that are very prevalent on the East Coast of the United States. One of them is the bypass surgery. The other one is the lymph node transplant surgery. So in a bypass surgery, they would just basically connect your lymphatic vessels directly to the venous system, because that's where eventually the lymphatic system will connect and eventually will dump. So that is a pretty, the surgery itself is very long. And the other thing is, with that type of surgery, no matter which surgery you go through, whether lymph node transfer or lymphatic transplant surgery, you would be wearing a compression sleeve after, and you will have to go through therapy after. It is not like a done deal. Like, yes, lymphedema does get a little bit better, but I will talk in insurance perspective also, because I run a business. I have to say this, when it comes to insurances, it's almost like running a business. Insurances want to see, basically, before they approve this type of surgery, is what kind of treatment was provided to you, whether you had the full-fledged manual treatment along with the bandaging, along with the Redux kit. I think you said you're using the Redux kit. So insurances want to see a failure of that type of treatment in order to provide you with that, approve you for this type of surgery. Because no matter what, this is an extremely intricate surgery. There are not many surgeons who do this to begin with.
That's true. He mentioned that he did suggest potentially considering the transplant surgery as well, where they transplanted lymph nodes from my abdominal area, but then that would include a reconstruction. They wanted to use abdominal tissue and reconstruct breasts. And I'm stage 4 metastatic, so I don't really want to do that. I would like to try to attempt the less invasive surgical procedure where they just, work on my arm and not do the lymph node transplant, if we can have success with that.
Absolutely. I couldn't agree with you more, because I am of the philosophy that at first we do no harm. We stick to what we know best. We stick to manual lymphedema drainage. We stick to bandaging, compression is what we stick. Failure of that after a certain period of time, you're done with it. You're like, okay, my lymphedema is just not getting better. Then we move on to a pump, we move on to having you in a pump treatment every day. So therapy has to go on for a long time, Kate. I hate to tell you this, but in this scenario,
that's the doctor mentioned that as well. It's DeFazio with MD Anderson, and he said the same thing. He said, I would need you in the sleeve for weeks before the surgery, and I would need you in the sleeve and with physical therapy for months post-surgery. And where do you live, Kate? I'm right outside of Jacksonville, Florida. So I go to MD Anderson in Jacksonville.
Okay.
And Dr. DeFazio has only been doing this procedure here in Jacksonville for a couple of years.
Yeah, I'm aware, because I'm aware of actually most of the surgeons on the East Coast who do this type of surgery. There are not many. I'm glad that you found somebody there, but in UPenn by us,
Yes.
There are a couple of surgeons who do this type of surgery, but don't be disheartened, Kate. Be in therapy, stick to your therapy, and I can guarantee you insurance will cover therapy more than they would cover a surgery of this type. Because you want to remember, these surgeries are also, they fall under the category of like, we don't know if it is the done deal kind of a thing.
Right.
So stick to what we know best. Follow the guidance of your surgeon. Okay.
Thank you. Thank you.
No
That's
problem
very
at all. And you can
very-
always reach back to me, like, I'm always ready to help.
And
Thank
I was going to say, Neepa, thank you for mentioning that. I can put your email, if that's okay, in the chat. So if anyone wants to reach out to you directly on their own for some questions, if we don't get to everything, but we will certainly try. Is it okay if I do that?
All right. I'm going
Perfect.
to actually answer this question that came up about vaccinations,
That was my next. Thank you. Go ahead, please.
because I think that is a very important question. So CDC actually released a paper way back when in last May, even before we had the vaccines. Yes, it is very safe for all cancer patients to take the vaccine. And I'm a big proponent for people to get the vaccine. If you have lymphedema in one arm, get the vaccine in the other arm. If you have lymphedema in both your arms, get the vaccine in your buttock area, because yes, and believe it or not, only doctors can give a vaccine in that area. So just, because I did my research on that, I've had patients talk to me about it. So go to your hospital and the doctors can give it in your butt. But the lymphatic arm technically shouldn't get the vaccine.
Okay, good to know. And I'm glad you mentioned that getting it in other parts of the body as well.
Yeah.
Tammy was asking about what types of exercises you could do at home.
So what is your condition is my question to Tammy, because exercises are not like it's not like a one thing for everybody. We always have to tailor exercises for everybody. So tell me more about you, Tammy. Did Tammy leave?
No, she's here. I just asked her to unmute. Maybe she stepped away a moment.
Hi, I'm here. How are you?
Hi.
Very
Hi.
good, Tammy.
Hi, I have the tender that you described about underneath the armpit where it feels like something's pulling, and I try to do like self-massaging and to try to help it to loosen it up. It does feel better for a little while, but it just doesn't last long.
That's right. That's the reason for that axillary web syndrome, more than likely what you have going on. Where are you, Tammy? I'm like trying to search her. Over here. I can't see her. But anyways, so if you do actually have axillary web syndrome, if you are actually feeling those guitar string like strings under your arm, or even over here in like the forearm, if you're feeling any of that, I would strongly suggest that you see a therapist to break that down, to release that before we do any therapy, because that has to be manually released by a therapist.
Okay.
And some lymphedema therapists would do that. And they are stretches, no doubt about that, but it has to be manually done first before you start an exercise protocol.
Okay, thank you.
Mm-hmm.
Perfect. Okay. Colleen asked an interesting question. Are there different types of lymphedema? She mentioned she has some breast lymphedema and her surgeon said she thinks it will improve over time. So are there different types?
So Colleen, let me ask you this. Number one, lymphedema can occur in any part of your body. Let me answer that, like simple and straight, because I've seen head, neck, abdomen, every part of your body, lymphedema can occur depending on which lymph nodes were removed. Legs and arms are most common. The breast area post-surgery is most common. But Colleen, did you have any lymph node dissection?
Yeah, I had 6 axillary removed, and
Okay.
I had radiation
Okay.
after a
So-
lumpectomy.
Okay. So in your case scenario, I mean, like, I am not going to go into details, medical details, because, technically, like, that is against any kind of, like, my profession. Like, I give advice just on the phone kind of thing, unless I actually see a person. But typically, just from what little you have told me, I would tell you there are compression pads that are available that a therapist could fit you for. And that pad can be worn in the nighttime, and it does reduce lymphedema. I do not want to agree with your surgeon that it will improve over time. You may have to seek help for getting fitted for that kind of a pad. Sometimes even a compression bra, or I oftentimes even make my own compression pads for the patients. So sometimes, like, that could help, but a therapist would also be able to teach you how to move this lymph around the breast, because the technique of moving lymph around the breast is a little bit different than just the arm.
Yeah, I have gone to physical therapy, and I guess my question was, the surgeon said that sometimes she sees lymphedema that, may, again, with therapy also, but may improve over, she said she thought like it could take like 1 to 2 years versus like a lymphedema that may always, that you may always have difficulty with. And I was just curious if not so much lymphedema in different body parts. I was wondering, are there types that are more short-lived, say after radiation, or that was kind of more my question.
Yes. The answer to that is yes. There are lymphedemas, like, especially if you've just had a lumpectomy, then the chances of you developing a full-fledged lymphedema period is very less. Like, you wouldn't develop full-fledged lymphedema. A little bit of massage, though, is needed to eliminate this fluid that is lingering around. It is not going to go away on its own, is what I'm going to advise you. So you should, like, continue with the therapy and get educated on how to move this fluid yourself, because it's only a 5-minute massage. Why not do it? Because it will take time for the lymphatic vessels to regrow. It takes anywhere between 6 months to 2 years. But when you do this massage, you're actually urging the body to grow these lymphatic vessels in a much faster manner.
Okay, yeah, that was my question. Thank you. That she thought that this type over time that the lymphatic vessels could recover.
They do grow, but we want to urge them with lymphatic massage, and it is a 5-minute massage. Literally, you could do it in the shower, but like I said, like, get educated with your therapist wherever you are. This is not something that I will teach you on this session, because it's against the scope of practice, and it would be wrong on my behalf to do that.
Okay, thank you so much.
You're welcome.
So Neepa, we had an interesting question from Elizabeth. You mentioned, I think, a little bit about temperature. She said she saw her radiation oncologist. He said it would be a few months before it would go down, and he suggested using ice or heat, whichever's more comfortable. Can you speak to temperature in terms of lymphedema and
that's a very interesting thing. Sometimes, like, I get amazed what the doctors would tell patients. I'm sorry, but when I saw radiation online, he said it would be a few months before scanning would go here. No, let's put an answer to that. Heat after radiation is a no-no. Let's begin with that. Any temperature beyond 97 degrees overall, like once you've had radiation treatment, once you had lymph node resection, any temperature beyond that is actually considered detrimental. I see more patients in the summertime just because of the heat, the repeat patients who come back to me in the summertime than any time of the year. So ice or heat, like, I do not want to agree to this doctor at all. Heat is a no-no. Ice can be done in small spurts. So you say you put 20 seconds ice pack, and, like, it's not like an ice pack. It needs to be more on a cold pack. Let's call it a cold pack. Like, for example, your peas, the peas that you keep in the refrigerator, something like that. You keep that on for 20 seconds and, like, a minute off, 20 seconds, a minute off. So you do not, the problem is, like, once radiation is done, it has now hampered the little nerves. And if we put ice or heat on it on a long period of time, it's going to damage it even further. So no, it's not an ice or heat situation. You can put a cold pack if you have a neuropathy kind of a situation going on, or if you have paresthesias going on. Does that answer your question, Elizabeth?
Yeah, it was kind of strange that that was even brought up. Luckily, I haven't gone the heat route, but I have put the ice pack on my arm. Only when it seems like it's a little more sensitive and swollen.
That's correct. And I'm presuming, Elizabeth, you've gone and seen a therapist for your lymphedema?
Not yet. Not yet, only because I just had the surgery, finished with the radiation the end of April. And then I saw the radiation oncologist the beginning of June. And he did say it would be a few months before the swelling went down. And that's when he mentioned about the ice or the heat. And then I saw my breast surgeon last Friday, and he double checked everything. And he seemed to think it was from the radiation and then some scarring from the surgery itself, but that it basically looks very good. But I'm even wondering if part of my problem would be that with shaving there, maybe I just should refrain for a while.
That is correct. Or use an electric shave, electric razor, basically. And I would refrain from using a proper razor, but electric razor. Nowadays they have those gold tipped razors. I forget the brand, but I have patients using it. They are like 18 karat gold tip, and they're very comfortable to use for most women.
And ironically, I do have one of them, but I thought I was in good enough shape to go back to the traditional razor. But
I would avoid it for now, at least for a year, give or take, because radiation after effects can last anywhere between like 6 months to 18 months, they say. And please, if you have asked me this question about ice or heat, I don't go that heat route, because you're going to destroy some of those little nerves that are now starting to come back. So
yeah, luckily I never did the heat, but I was actually
very good.
Yeah, if anything, probably more of the ice.
That's right. As also with the ice, stick to something that's more of a cold pack than direct ice.
Right. And even when I was using the ice, I obviously didn't apply it directly to the skin. I wrapped it around a towel.
Perfect.
So it wasn't like it was direct on it.
Perfect. Yeah, I mean, sometimes when surgeons and oncologists give directions, they don't give clear directions. And, I have people who would jump in a hot shower right after radiation. And it's like, oh my God, it's not recommended, but nobody told them not to.
Good. Okay. Thank you for that. Okay, Robin had a question just about length of time. She said this doesn't occur fast and she would see it in 9 months to a year. I guess the development of lymphedema, Robin, if that's what you're talking about, which Neepa, I brought up to you before, just in my conversations, I had one of our women mentioned to me that it was over a year when she started to notice lymphedema. So do you want to reiterate again, just sort of the time frame as to when a person may start to see symptoms? It doesn't have to be right away.
All right. So, Robin, since you have mentioned this question on a group chat, I am going to use you as an example, if you're okay with that, Robin. Robin, are you around? I need an okay from you.
You can use me as an example. Oh, there she is. Okay.
Can you hear me?
Yes.
Can you hear me?
Yes.
Yes, you can use me as an example.
All right. So in Robin's case scenario, she has had 16 nodes removed, which means, which means she had the entire level 1 lymph nodes removed from her axillary area. So basically you have level 1, level 2, level 3. So level 1 is the first level that is removed in any type of breast surgery. If they go in and find out that like pathologically there's some kind of cancer cells, then they go and remove the entire pad. So you've had the most, I would say, as far as lymphedema is concerned, you've had a very aggressive surgery that was done on you. So your lymphedema would develop sooner, later, if you are in great health, Robin, to begin with, you were a runner, you were a weightlifter, chances are very high that your lymphedema would develop later. But if you were a person like me who loves her walks and just does regular exercises and not anything aggressive, then chances are very high that the lymphedema would develop sooner. Like you would start seeing the symptoms much sooner. Now, the good news is that the sooner this is detected, the sooner we can treat it. And the sooner we can try and reverse this lymphedema. So don't wait, you don't want to wait for radiation to start. If you have symptoms of say, numbness or tightness, see a therapist right away, because it's much easier for us to treat at that period of time versus when you develop this full-fledged lymphedema.
Which I have numbness, and I wasn't sure, was it from the surgery? I know my range of motion was off, but now that's in unison with my right hand. So my range of motion is good, but I am still numb from my elbow to my armpit and a little bit down further. And I'm also feeling like, after reading your program that you said about the web, the axillary web, I feel like I have that.
Okay.
So
okay. Where
the
are you
person I spoke to said, oh, no, you have to wait. But you're saying I don't have to wait. I didn't get chemo or radiation yet. I'm going to start in probably 2 weeks.
And that's fine. You can start therapy and you can still get therapy. I have patients who are on chemo and radiation at the same time, and I still see them. There's no problem. The only issue is that when radiation starts, say you have 20 rounds of radiation. The only time frame that I cannot touch that part of the skin which is radiated. That is the only issue with radiation. But I still see my patients for releasing the cords through radiation. I still see my patients to move lymph, maybe not in the axillary area, maybe I'll work around the neck, from the arm to the neck, because I'm working now incorporating other lymph nodes to come into picture. But yes, I mean, I cannot stress the importance of getting this treated sooner than waiting for it later.
Okay, I'll work on that tomorrow. Thank you.
Absolutely. Get a script from your doctor. That is why. Be proactive.
Oh, absolutely. And I wanted to be proactive. This was one of my worries of me having cancers. Am I going to get lymphedema? How can I prevent it? And when I spoke to the lymphedema specialist, she was just like, oh, you have to wait. It probably won't happen for a year or so. And I asked her to measure me so that I would know, just in case, if there's changes. But I didn't know about the web, the axillary web, and the tightening. And I have that. So I didn't know, is that from surgery or is it from this lymphedema?
Like I said, it is. So when I explained what an axillary web is, it basically is something, a scar tissue that's choking your lymphatics. So we want to release that. And therapists do it manually. Basically, we are trained, I was trained to release this manually. I actually work on sometimes, and this, let this not sound like a big problem, but sometimes people will hear a snap and there's instant relief. Because I have now released their cord or release their axillary web. So please, if you feel you have that kind of tightness going on, don't wait, because why do we want to get treated? Because it's not a big issue. You're still able to raise your arm, but eventually what will happen is it'll affect your shoulder range of motion. It'll cause arthritis in your shoulder, because now the body feels, oh, the shoulder is not moving, might as well bring in inflammation here. It's just a natural body's response. So you want to prevent all that from happening, get your full range back. The numbness, though, may take time to return. but
Okay.
with proper therapy techniques called as desensitization techniques, a therapist should be able to talk to you about it. You should be able to get at least some of the sensations back.
Thank you so much. I appreciate it.
Anytime.
That was super helpful. Okay, I'm going to go through and try to get through as many questions as we can. Audrey had an interesting question. She wasn't diagnosed with lymphedema until 7.5 years after surgery, then 5 months later diagnosed with metastatic breast cancer. Do you know, is there any connection between the onset and a stage 4 diagnosis?
I do not know a connection between lymphedema and the onset of metastatic breast cancer, because the way we look at it in the medical profession is the metastasis was always there, like it was just not prevalent. I mean, like, obviously, when I can talk about lymphedema, you could have gotten treated for lymphedema, but finding a correlation between lymphedema, it's a very benign thing in your body. Its job is to move all the debris that the circulatory system leaves behind. So in that debris, if there was cancer cells, yeah, the lymph moved the cancer cells also, unfortunately. But I wouldn't say there's a correlation between lymphedema and your diagnosis, unfortunately.
Okay, thank you.
Thank you. Thank you.
Anytime, Audrey.
Okay, is a lymph node dissection the same as a regular biopsy?
No. So there are two things that are done in a surgical setup. So when a person goes in for surgery, you have to actually sign a disclaimer. And I am telling you this because I've attended several surgeries in order for my own understanding as to what exactly is going on. So people usually, like, the surgeons will have you sign a disclaimer, because when you go in for surgery, they do not know whether one lymph node is affected or there are many lymph nodes that are affected. So that the way they do it is, so they remove the tumor. Okay, so they go in, like, you're prepped, your arm is stretched out like so. Okay, that is how they keep your arm. They remove the tumor or the malignancy, and then they inject a dye in. Okay, this dye then goes to 2 to 3 lymph nodes. Okay, so then they remove those 2 to 3 lymph nodes, which is called sentinel lymph node biopsy. So that those lymph nodes are then sent immediately to pathology, and within 15-20 minutes, the pathologist will tell you, or whether they call on a phone, which is hanging on a wall, and the surgeon is waiting till then. So you are on the table and the surgeon is not doing anything for 15 minutes. So the pathology calls back and says, okay, we found cancer in 2 lymph nodes. We found cancer in 1 lymph node. Even if they found cancer in 1 lymph node, they will go ahead and do a full axillary node dissection. So they basically then remove the pad, which has the lymph nodes. And the pad looks like a fatty tissue. Sorry, I'm being gross, ladies, but I've seen this, so I'm explaining it more in detail. So the pad, has all these lymph nodes set in there, okay? And at that time too, the surgeon doesn't know how many lymph nodes were removed until that pad is now sent to pathology. And then the pathologist will then dissect it and do their thing and say, okay, there were 20 lymph nodes in this pad, there were 18 lymph nodes in this pad. So that is called a full axillary node dissection. But if the sentinel node is negative, then they do not remove the axillary nodes, and which means that you wouldn't end up with full-fledged lymphedema. I haven't seen one single patient with full-fledged lymphedema after just a sentinel node being removed.
Wow. Thank you for that explanation. And that was a really great question.
Mm-hmm.
Okay, Amy asked, do you deal with iron bra syndrome at all? Can you explain what that is?
I do not know the term iron bra. So Amy, if you can elaborate that may be some kind of term used in your hospital. It could be related to fibrosis, but tell me what it is. What is going on with you, Amy?
Hi, Neepa. Thank you.
Hi there.
Yeah, I think you can also refer to it as post-mastectomy syndrome. It's a terrible tightness all throughout the chest, and it just feels like you have this really tight, like a bra or a lasso around your chest, and you can't ever take it off.
Yeah, it's called a post-mastectomy pain syndrome. And it is actually a legal term where like it can be a legal diagnosis. When we do coding, we can use that. I'd never thought that they would call it iron bra syndrome. But so thank you for educating me on that term.
My pleasure.
Yes, that is again something that, so if you have not just a lymphedema therapist, but a therapist who practices manual techniques for myofascial release, would help tremendously in helping with this kind of a syndrome for you. So a therapist who actually manually works on, so there are many manual techniques that over the course of many years that I have taken training in, where like I'm working on like this tightness, I'm working on this pain, I'm working on reducing, and I see very good results. So it doesn't necessarily have to be a lymphedema therapist that you may have to see, but a therapist who practices myofascial release is who you need to see for this particular syndrome.
Okay, wonderful. Thank you.
Mm-hmm.
Okay, Angela asked, which this has come up a couple times, should a person, if you have lymphedema, should they avoid hot tubs? And can you speak a little bit to waxing versus shaving in that affected region?
Yes. Yes, you should avoid hot tubs. That is something every therapist will tell you about because we don't know the temperatures. Like I said earlier, like 97 and below is the optimum temperature. Hot tubs are much hotter than that. Shaving versus waxing, I would avoid waxing. I would rather use an electric razor. I've had a lot of luck with patients even doing laser treatments, and it is completely safe to do that as well for managing the hair on your legs.
Thank you.
Mm-hmm.
This is great. Okay, Diane had a couple questions. Leg cramps in the lower leg, is that part of lymphedema? And then she also mentioned, does lifting heavy weights, does that affect lymphedema, aggravate it at all?
Which part of your body is the lymphedema in, Diane? In your legs?
I didn't really know what how do you pronounce it, lymphedema? I didn't really know what it was. And then I started having like these pains.
Mm-hmm.
And I don't know if it's from my medicine that I was taking. So I wasn't really sure. I went back to the doctor and they come and go. First, it's in the lower leg near the ankle. Then it goes away.
Okay.
And it doesn't come back.
It sounds more like a neuropathy kind of a pain, which gets aggravated because of lymphedema. Like, we want to blame lymphedema, but lymphedema is not always the culprit. Like, there are many causes for neuropathies to happen. The best way to sort of deal with it is like, some of the times, like, your doctors would put you on nerve medications. You may have heard of like gabapentin, pregabalin, and those kind of drugs. Some doctors do put patients on those type of drugs, which are helpful. But therapy wise, I can tell you, like, you can, if you are able to find a bucket, say rice, do not use the rice for eating at all. Fill a bucket with rice and wiggle your toes inside that rice. That is a kind of a sensory technique that we use for neuropathies and like, these shooting pains that you get. So try to do that, like say 5 minutes every day or so.
Oh, okay. And I had trigger finger. Are you familiar with that?
That's more of an orthopedic condition.
It's what kind of condition?
It's more of an orthopedic condition. But yeah, you can talk to me about it. Okay,
well, I went to the Rothman Center. And I also went to see a specialist who did an ultrasound. And they injected me in my hand with a needle. Okay. That finger feels fine, but every now and then when I bend or make a fist, every now and then that finger will slow up and I have to peel it up. And I couldn't understand what was going on. I said, am I getting something after the radiation? Is that? I don't think that is, it could be related. I mean, where did you have radiation, Robin? It was the breast. My name is Diane. It was the breast. Diane, I'm sorry. No, don't be sorry. It's all right. It was in the breast. It was very small. There was no lymph nodes. They removed it. but
I'll tell you this as an occupational therapist, and this answer is coming from an occupational therapist, not a lymphedema therapist. Typically, trigger fingers are more of like a orthopedic in nature. They are not related to radiation per se. I mean, you must have had something different going on, and which led to trigger finger. But yes, cortisone shots are very common practice for trigger finger. Sometimes they also do splinting, like, they'll give you a splint to wear at night.
Yeah, I have one.
Yeah.
I have one, but I was lifting a lot of weights and I didn't know if I was lifting too many weights that caused it.
That's right.
I'm up to 10 pounds now.
We cannot attribute a trigger finger or any orthopedic conditions to good old radiation that is helping us.
Thank you so much. I appreciate it.
Absolutely. There was a question, Erin, about the weights, and I did not answer that. Like, is weight training good? And I think there was a question. So anyways, ladies, I'm just going to mention a little bit about weight training. This question has appeared many times with reference to lymphedema. Is weight training good? So yes and no is the answer, and I'll tell you why. Yes, because so long you're trained properly by under a PALS technique, which is physical activity and lymphedema. It was a certified technique which was brought forth by I can't remember the name of this woman. In 2011 or 2010, this woman brought this technique, and it is a whole protocol of how to use weights. And she showed, there were many papers that were published actually in cancer journals, how weight training can actually help lymphedema. But there's a whole protocol to follow with that. And sometimes I do that. Like if my patients are asking for it, I will follow that protocol and bring them to weight training. But if you decide in one day that, oh, I'm going to lift 10 pounds today, that is not the way to go. In the PALS technique teaches us how to gradually increase the weight, how to properly use our muscles for weight. For weight training. It's a whole technique. It's a whole scenario. Which some therapists are certified, because now it doesn't exist, but like in a long time, because I've been in the business for so long, like, yes, I was certified in this kind of a technique. It's called a PALS, PALS, physical activity and lymphedema. And it stresses on weightlifting and how to do it properly.
Okay, thank you so much.
Really interesting. And to that point, Neepa, and we'll wrap up in just a few minutes. Is it okay if we answer a couple more questions? This is really wonderful. Okay, so Ingrid, she mentioned having lymphedema, feet and ankles from ovarian cancer. Is okay? Or for her, is there anything that should be avoided?
Ingrid, did you see a lymphedema therapist before I answer this question? Ingrid, are you there?
Let's see if we can find Ingrid.
There, I'm unmuted. I was having
problems.
Hi. I'm actually was going to a massage therapist who is certified in lymphedema massage. It's not helping all. I mean, I can't go there every day, obviously. So I'm going once every couple of weeks, and it doesn't seem to be helping all that much. And I think I'm in the early stages of lymphedema, so I'd like to nip this in the bud if I can.
Yes. Where are you located, Ingrid?
I'm in Philadelphia.
You're in Philadelphia. Okay. Actually, I can see you. I can, but if you are further down in Philadelphia, and if I am too far, it is.
No, you're not too far. I'm in northern Philadelphia, so you're not. No, you're in Newtown Square.
No, I'm not in Newtown Square. I'm in Newtown in Bucks County.
Okay.
Yeah. It's what I'm seeing from your question is that you're starting with the lymphedema, and exercises are absolute must. They have to be done correctly. But if we want to nip this in the bud, then we want to see a therapist right off the bat. Okay, because let's start with saying that when it comes to lymphedema, you want to see a certified lymphedema therapist who's an occupational therapist, a physical therapist, an MD or an RN. Okay, massage therapy can happen as an adjuvant. or like at the later part of your treatment. But a combination of exercises, compression, manual lymphatic drainage, all this combined together has to happen in order for lymphedema to be controlled. You can't control it just with massage. You can't control it just with exercises. It has to happen together. Unfortunately, like, I teach a lifestyle. Like, you want to adhere to some kind of a protocol, like where you are not just doing one thing at a time. You're doing many things, like, and in addition to that, like, trying to lead your normal life, like, going to work or like going for your walks. But if you are only seeing a massage therapist, it's not adequate. Let's put it that way.
Okay, thank you.
Okay, two more quick questions. Angela, I thought this was a great question. Would a therapist be able to tell a person what stage of lymphedema they have?
Absolutely. Okay. Absolutely, yes, because we're trained to do that. And, in my one of my slides, I had actually mentioned, like, how therapists we gauge that.
Okay, good to know. And we had a question about the RICE method you mentioned. Does the RICE method that you mentioned in the feet work if they have lymphedema in the arm, or is the RICE method not so much for lymphedema?
That is correct, Erin. The RICE method is not much for lymphedema. It's more for neuropathies and paresthesias. Yeah, it is more for like desensitization of nerves, and it is not for lymphedema. Correct.
Okay. If a person does have, I know for me, I'd love to share that when I'm on the phone with our community. If they have lymphedema also, or, I'm sorry, neuropathy in their hands, is that an activity that they
Absolutely. Could do? Just don't eat that rice, and it is dry rice. Keep that bowl separate from all your, you never know what cookies are in there.
Okay. And one final question before we wrap up that I thought this was a great way to end. If someone that's attending or someone that will be watching this in our HER library, if they're unable to see you, Neepa, how can they find a lymphedema specialist?
So the Lymphedema Association of North America has a website of certified therapists. And I'm actually working my way up in there because that's a separate certification. Like you can have a certified lymphedema therapist a degree to yourself, but I'm also working to be on the LANA, which is the Lymphology Association of North America. They have a website where they have a listing of all the therapists. And Close Institute, KLOSE Institute, and Norton Institute have their own set of therapists as well. So my names are on both because the guys used to be together when I did the course. So they have listed in every state and every county the names of lymphedema therapists. But LANA, the Lymphology Association of North America, is a great place to start.
Perfect. Perfect. That is wonderful. Excellent. Okay, so I think with that, we will wrap up for the evening. I know we could probably take up at least a whole nother hour asking questions and sharing about us. And so I so appreciate your expertise and taking the time with us, Neepa. I know, and just seeing all of the thanks through our chat, how grateful everyone that hopped on this evening is to have you. And we're so thankful you're part of our community. We have you.
I have literally devoted my life to this particular issue, and it's a less talked about issue, and I shoot me any questions because I would love to do that. It's just that I cannot solve your problems, but at least I can give you some advice.
Absolutely. Yeah. And we appreciate it. I did put your email in the chat. Again, for those of you, because we covered a lot, remember this series is being recorded. It will be at uniteforher.org/herlibrary, and you can see our speaker series, Ask the Experts, all of our virtual events that we have going on. So feel free to go back and rewatch this and just listen again. So I want to thank everyone for hopping on. We so appreciate you being with us, spending your Thursday evening with us. This was absolutely amazing. Neepa, again, so thankful to have you in our community, and be on the lookout for future events that we have coming on, but we hope everyone stays safe and stays well, and we will see you again next time. So thank you, everyone. Take care.
Take care, guys.
Thank you.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
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 Bye.
Bye. Bye, Erin.
Bye.